It's time to talk about semaglutide again. I don't know, what is this, my 100th video on semaglutide. We've been prescribing this for a long time, and I really want to go over some things that really are important when it comes to making things different for you and getting the best possible results for semaglutide, tirzepatide, these fantastic weight loss medications that are taking the nation by storm. And here's some of the things that we do differently, and I have it right here on my list. First of all, we're monitoring body composition. We use something called the InBody 570. It's one of the best possible scales that they have out there. They're telling us very accurate, not only weight, but also your muscle content. And I am stressing this over and over and over again about muscle. We need to preserve muscle. We do not want weight loss. We want fat loss. And we want muscle preservation, and we actually want muscle gain if we can get it. And by the way, I have patients who gain muscle when they're on semaglutide and tirzepatide. You'll hear all kinds of things, and again, nonsense out there. It's how other doctors are doing it incorrectly. It's how other patients are using it incorrectly. You don't have to lose muscle when you're on semaglutide and tirzepatide if you're going through a process of actually getting properly monitored in the right treatment. What else? We use potent versions of the medication. I mean, I have seen patients now come back to me with, they go, well, I got it cheaper. And then they show me the vial. And it's half the potency of what we usually prescribe, and I've been prescribing this for 3 years. So this is part of the nonsense out there too, so be careful with that. They might say it's cheaper, but you get what you pay for, and then it might not be the right dose for you. We are, I just said this, we're early adopters. We've been prescribing this for 3 years. This is the way I've always been. I know how to identify things early on when it comes to medical trends and new things that are cutting edge out there. So again, 3 years of doing this at least. Now everybody's been doing, past a year, everybody's doing it. So we calculate the optimal amount of protein. I think that's really important. That InBody test that I mentioned before gives us very, very accurate understandings about your muscle, and therefore we can do really accurate calculations about your protein intake and then ensure you're really focusing on that. If you focus on your protein, you're not going to lose muscle. It's a simple calculation, and it's just simple math. So we can help guide you with that too. And of course, we're optimizing your hormone levels. Again, 18 years of playing this game with hormone replacement therapy. It's pretty basic for us to have a foundation of hormone in place for you that prevents you from losing the muscle and further optimizing your metabolic rate to get better results from the semaglutide or the tirzepatide. But here's the big thing. What we're seeing now, and again, you can look this up and you'll see it out there, the idea that people are losing weight so rapidly, that usually includes muscle. But even if they are preserving muscle and they're losing fat very rapidly, there can be some skin laxity that comes along with that. It's just one of the risks. And I don't care if we're talking about semaglutide, tirzepatide, any of the other weight loss medications that have been out there. If you have rapid loss of weight, fat and or muscle, you're gonna probably have some level of skin laxity. It's just what happens with that. So we have an option of being able to medically treat this skin laxity using hyperdilute Radiesse. So this is a certain type of filler that we can kind of go into the areas, whether this is the back of the arm or wherever you're having an issue with skin laxity after you've had this weight loss, we can go in and actually help to improve that. Make sure you're asking about that option too. So you want to look at everything holistically. You want to be able to have a comprehensive approach. That's what we do. My name's Dr. John Robinson, longevity medicine expert.